Okay.
4 is the highest. So it's pretty
Okay.
scary. Yes.
I understand. Yeah.
Yes.
So during that time, I would imagine you had some people around you to support you. Who was your support system?
Yes, I did. I call them my prayer posse. I had several friends, and because I don't have immediate family in Georgia at the time, I had an adopted dad, Willie Childs. He was there every chemo session, and several friends that would go with me and pray. And they knew when I would come into the area, and I was married at the time. My husband, he would come with me along with the prayer posse. I'd roll in there like 7 deep, just to have that energy around me for
Yeah.
healing. Things have changed now since COVID. Everybody can't go back there. A lot of times no one can go back there but the patient. I don't know how they do it now, but it's kind of scary. I was thankful to have someone to hold my hand.
Yeah. Yeah. I'm so happy you had a great support system. I mean, you were rolling 7 deep. You sound like, a
Yes.
superstar. They were like, watch out, Miss Judith is coming through.
They knew when I'd enter, there she is.
Yeah. Not only to have people there holding your hand, but the prayers, the words of encouragement,
Yes.
on those days where you might felt like, your body was a little tired, and just for them to say something encouraging, or just their presence.
Yes. My mom was alive.
Just talking to you right now, I'm trying to keep my body still because I feel like I'm shivering, but I can only.
It's a blessing. My mom was alive. She would come. She stayed with me for about 3 months, helping me. It was a blessing, truly.
Yeah, that definitely was a blessing.
Yes.
So, when you go through treatment like that, I would imagine you probably made some changes to your health, or to your diet, or even mentally. You might have said, you know what, I'm not going to let anything stress me out. What kind of health changes did you make at that time to help you get through the treatment?
Well, one of the changes I made, which is important during the recovery, is drinking more water. I can remember when I went, okay, you have chemo day 1, the next day you go back and get a shot to boost your white blood cells. So there was a young lady in the room, we're all in there, we're going through the same thing. She was not drinking the water. And so one of the nurses said to her, and I heard her, and it kind of snapped me into being a water freak, now. She said, I'll just call her Betty. Miss Betty, you haven't been drinking the water. You're dehydrated. If you can't drink the water, we can do one or two things. We can send you back home and ask you to drink more, or we can take you across the street, which was exactly across the street from the hospital. I was like, no, I can drink water. I wasn't a big water fan at the time, but I'm a big water fan now because of that, because those drugs need to flush through your system before the next round. So drinking more water was one of them. I was so concerned about my weight. I had lost so much weight. I just wanted to eat. I tried not to eat all the wrong things. Tried to do more fruits and vegetables, which is always wonderful to be able to do. But those were the two things. Just try to eat better, more fruits and vegetables, drink way more water than what I would normally drink. But that was it. That was it.
Okay.
My mindset definitely changed. I wanted to live. I wanted to be happy and to bring joy to others around me, which I always wanted to do that anyway. I thought I was doing a pretty good job. But cancer, it pushes you to be more. It pushes you to be better. It's the way that you approach it. You can have a pity party and feel really sorry for yourself, or you can be determined to fight. And that's the person I became. There were slow days. Every day was not a cakewalk. I'm not saying that. But what I am saying is, in your spirit and the faith, the mustard seed faith that God gives you, you must have that mentality, that warrior mentality. And from the day that you walk out of that doctor's office, when you are diagnosed, you become a survivor because you're still here.
Right.
So to me, that's my definition of being a survivor. As soon as you're told, your mindset changes and says, I want to live. I want to give everything that I have to someone else. It takes away a lot of your selfishness.
Okay. And I'm going to ask you a question, and I don't want you to think that what I'm about to ask you, this is the most important thing, but I just know somebody might be thinking about this. Were you able to work while you were undergoing your chemo treatments?
No, I was not. Those drugs are so powerful. I admire people that can, but those drugs are so powerful. It zaps your energy.
Mm-hmm.
You have no energy. Yeah, I didn't want to eat a lot. Your appetite changes. The taste buds in your mouth changes. Your neuropathy is common. It's where the nerve endings, like in your hands or your
Mm-hmm.
feet. You're walking, but it doesn't feel like you're walking because the nerves are just so aggravated. So no, I couldn't. I threw up a lot. There was a lot of nausea. So I just took the time off from my job, and thank God I had a job that allowed me to. I could just stay at home and take care of me. So for about 5 months, I couldn't
Mm-hmm.
work.
Okay.
Mm-hmm.
So after you went through all of your treatment, you got to experience something that I've seen people do, and it requires you ring a bell. Did you do that? Did you ring the
At
bell?
that time, the bell was not, it was not in place at my,
Okay.
at Augusta Oncology. So that is something new that I love to see now. But
Mm-hmm.
back in 2006, it was not available. So
Okay. Did
I've
you?
seen people get like little certificates and all. I didn't get that. I got hand claps as in yay, she's
Yeah.
finished. But I did not have the bell at the time. I don't remember having the bell because I'm sure somebody would have taken a picture of that. But there was
Right.
not a bell back then.
Was there anything that you did to celebrate that moment that you found out your treatment was done and the cancer was gone? Did you do anything to celebrate that moment?
Well, there's a break in between last treatment and then next actually being clean because you still
Okay.
have to go undergo doctor's appointments where they scan you, look and see if there's anything else going on the inside. So for a full year, that's what happens at that time. It's much better now, you know,
Mhm.
uh, as far as diagnosing, looking, and after treatment, they can tell right away. But at the time, I just had to go back every 3 months to get a scan, and of course, lab tests and so forth. So I love
Oh,
the idea of the bell. I think that's awesome.
what kind of scan did you have to have done?
PET scan. PET scan is some nice long scientific explanation for PET, but it's actually a machine that scans your whole body from the top of your head to your feet. You can have other scans that, like for my breast, they could just only look at the breast, but they really need to look at your whole body to see because cancer is a booger. It will go anywhere in your body. So the full PET scan, I had those consistently, and I also had chest scans because I elected not to have my right breast removed. Um, they always have to check. But I felt
Okay.
as if, was having the left side done, that would be it. But unfortunately, it was not.
So
Came back on the
how
right.
so the second diagnosis was the right breast.
Yes.
So can
It,
you take us, before we talk about the right breast, can you take us
mhm.
through, if it's not, if it's okay with you, can you take us through the procedure of having to have the mastectomy done?
Oh, wow,
How
it's
do they prepare
traumatizing.
you? Okay,
It is
we
so
don't have to talk
traumatizing.
about. No, no,
No, no,
no. We
no.
don't have to
But
talk
I
about
want
that.
people to know what happens and the way that you feel after it happens. At the time, being 44 years old, I felt, that was very important to me. But I also knew I didn't want to die. So it was not that I'm struggling. Oh my, do I do it? It's just a matter of when. And when that day comes, the tissue in a woman's breast, and a lot of Black women have trouble with having very dense breasts, thick. And I was one of those people. Um, sure that you'll be afraid, but it's the right thing to do. It's the right thing to do. I had a great surgeon, Dr. Randy Cooper, and I also had a great plastic surgeon. So what they did, they could do it at the same time. It's called a tram flap. They take the muscle in your abdomen, just
Mhm.
below, your reproductive parts, and push
Mhm.
that muscle up through your chest and form a breast. And that's what I
Mhm.
have on the left side. And they could have either done that or like the density around the back area of my left side from my back can push that around, but I didn't have enough of that. So they took the abdomen muscle, pushed it up, and created and shaped a breast. So I wanted to look as normal, or what I
Mhm.
perceived to be as normal
Mhm.
as possible.
Mhm.
So it was a great thing. I had a
Yeah.
great surgeon, and I think it looks good. I've never had any troubles out of it or anything.
Mhm. Yeah, do you think that made it a little easier to go through the procedure, knowing that once that that breast was done, that you were going to get another one at that time? Do you think
Yes,
that made it
it
a little
did.
bit easier?
Again, vanity.
Hmm.
But
Yep.
I don't know. It's something about a woman's hair and her breast. That's what makes her a woman. But actually, those are the
Yeah.
physical appearances. That's
Hmm.
not what God made you on the inside. So, yeah,
Yeah.
I had to come to terms with it. It was not easy. It was
Hmm.
not, but I made it.
Yeah. Um, I um, I just turned 40 years old,
Okay.
and um, I had to go get a mammogram done.
Okay.
And um, when I went in to get a test for something else, but then they saw a lump, and so I had to get a mammogram done. And I know this is your interview. I just want to share because all of us can share with each other. But I remember that feeling in between being told I had to go get the mammogram done and the
Mm-hmm.
appointment. And I'm happy to say that I do not have breast cancer. But I just remember the emotions.
Mm-hmm.
But I fought off any negative feelings with prayer,
Yeah.
and just saying, God, whatever it is that you're going to take me through it, because he's taken me through so
Mm.
many things,
Yeah.
So I'm sorry, I try not to get emotional, but
It's
I,
it's okay.
I can
I
only,
understand.
I can only imagine how you felt. And I only had to have that feeling for a short amount of time,
I
you
can
know.
really relate to what you're saying, especially when you don't know what's going on.
Mm-hmm.
Um, they rush you immediately downstairs. They got to take all these pictures, MRI, ultrasonogram, ultrasound, all of these things. And you really
Mm-hmm.
don't know in the moment what is going on. Why am I having to go test after test after test?
Mm-hmm.
And it's scary because the waiting